She was pregnant for 9 months with a set of twins. Never saw a doctor once. And then suddenly she started convulsing in the middle of the night. Alima, a 27-year-old woman, was rushed into the obstetrics emergency at about 2 a.m. unconscious, soaked in her sweat and actively convulsing. This was her first pregnancy. According to her family members, the pregnancy had been completely normal. No morning sickness, no food cravings or aversions, no headaches or fever. There was no history of cramps or spotting. No hospital visits or antenatal care was sought by Alima. No checkups. She never had her BP checked or weight taken. No blood or urine investigations done. I mean, no lab workup whatsoever. I think she believed she didn't need them. She apparently qualified to be categorized as a pregnant woman who didn't know what pregnancy symptoms looked like at all. But that night, just before bedtime, she complained of a sudden onset of severe headache. Then blood visions followed. Herself and her husband normalized her symptoms, even casually diagnosed it as symptoms of imminent labor. They were expecting their twin babies. But when she woke up to pee at around 2 a.m., she suddenly collapsed and started convulsing. By the time she arrived at the hospital, she had already had 3 episodes of seizures. Her blood pressure was critically high. I'm talking 235 over 128 millimeters of mercury. She wasn't responding. Her baby's heartbeat was dropping. The heartbeat of the second twin was already absent. This condition is called eclampsia, a life-threatening complication of pregnancy. Markedly elevated blood pressure and protein level in urine in pregnancy or labor and causing seizures. It can lead to stroke, organ failure, and even death if not treated immediately. Fetal complications can also be severe or grave, like we already picked up from scan in the second twin. Suddenly, she convulsed again, right on the emergency bed. Her oxygen level crashed. The first twin was becoming distressed also. There was no time left to waste. The team acted fast. Magnesium sulfate was given to stop the seizures. Blood and urine samples were taken and sent to the lab. Oxygen was administered. IV access secured. Urinary catheter passed and consent sent to the neonatologist for baby's resuscitation in the operating theater. Her husband signed the consent form for the emergency cesarean section with tremors and shaky hands. She was rushed in for an emergency cesarean section. The twins were delivered. The leading twin barely breathing, but alive. But the second twin wasn't as lucky. After intense resuscitation by the neonatologist and pediatric residents in complaint of the pediatric nurse, the baby cried and was moved immediately to the special care baby unit of the hospital. The mother was stabilized in the intensive care unit and she survived, but not without undergoing 2 sections of dialysis. This could have been prevented. Simple antenatal visits could have detected a rising blood pressure during pregnancy. Eclampsia doesn't just happen. It gives warning signs, but only if you check. If you are pregnant or you know someone who is, please and please do not skip antenatal care. It is not optional. It can save lives. It is not enough to be pregnant and have a baby. The goal of standard obstetric care is to have a mother and a baby or babies alive and well at the end of pregnancy, irrespective of the route of delivery. If you would like to learn more from real medical stories that matter with lessons that could be life-saving, then subscribe to this channel and turn on your notification bell because the next video you will watch may be a lifesaver. Cheers! I would see you in the next one.